Hello, welcome to NextMeds. If you haven't subscribed to our channel, please hit the subscribe button for daily videos about health, nutrition, and disease-related videos. Primary postpartum hemorrhage is defined as a loss of more than 500 milliliters of blood within 24 hours after vaginal delivery or more than 1,000 milliliters of blood after a cesarean section. Postpartum hemorrhage can be atonic, traumatic, or due to coagulation failure, simply as trauma, thrombin, tissue, and tone. Let's see the causes for postpartum hemorrhage. First one is atonic postpartum hemorrhage. Causes are retained placenta or placental parts, multiple pregnancy, polyhydramnios, prolonged labor, placental abruption, placenta previa, grand multiparity, deep general anesthesia, submucous fibroids, uterine abnormalities, anemia. Let's see the causes for traumatic postpartum hemorrhage. Precipitate labor, instrumental delivery, cesarean section, episiotomy, uterine rupture, uterine inversion. Let's see the causes for coagulation failure. Placental abruption, eclampsia, sepsis, prolonged intrauterine death, amniotic fluid embolism, anticoagulant therapy. Let's see the management. Resuscitation is the first step in the management of an emergency. The first step is to insert two 14-gauge cannulae and commence intravenous crystalloids and colloids till blood is available. Assess airway and breathing. Give oxygen by face mask at 10 to 15 liters per minute. Cross-match 6 units of blood and commence transfusion as soon as possible because the circulating volume should be restored with blood. Uncross-matched O-rhesus negative blood can be given initially if the patient is collapsed. Take blood for baseline full blood count and coagulation screen. Diagnosing the cause. The first step is to inquire whether the placenta has been expelled. If the placenta is retained, perform manual removal of the placenta. If the placenta is expelled, the next step in diagnosing the cause of hemorrhage is palpation of the abdomen to determine the consistency of the uterus and the level of the fundus. The fundus should be at or below the umbilicus soon after delivery. If the uterus is relaxed and the fundus is above the umbilicus, the bleeding is due to uterine atony. If the uterus remains well contracted, the bleeding is due to trauma of the genital tract. Let's see definitive treatment of atonic postpartum hemorrhage. In atonic postpartum hemorrhage, the first step in the management is to inspect the placenta and membranes for completeness. If incomplete, perform a manual removal in the labor ward. The bladder should be emptied. If the placenta and membranes have been completely expelled and the uterus is empty, the next step is to administer intravenous oxytocic drugs. Commence with an intravenous bolus of 5 units of oxytocin. Can be repeated once. Administer an intravenous infusion of 40 units of oxytocin in 500 milliliters of Hartmann's solution. Administer an intravenous bolus of 0.5 mg of ergometrine. Can be repeated once, but ergometrine is contraindicated for management of the third stage in those with heart disease and hypertension, but can be used with caution for the management of postpartum hemorrhage. Insert 1,000 microgram of misoprostol into the rectum if bleeding still continues. Administer an intramuscular injection of 0.25 mg of carboprost. Can be repeated once in 15 minutes up to a maximum of 8 doses. Administer an intraniometrial injection of 0.5 mg of carboprost. But carboprost is contraindicated in those with asthma. Continually massage the uterus or perform bimanual compression to facilitate contraction. If bleeding continues despite medical management, the next step is to insert a condom catheter or balloon tamponade. If bleeding still continues, perform a laparotomy and carry out the following procedures in the given order till the bleeding is controlled. Number 1 is insert b-lynch suture. Number 2 is ligate the uterine arteries. Number 3 is ligate the internal iliac arteries. The final option is to perform a hysterectomy if bleeding cannot be controlled. It's crucial to have a multidisciplinary approach involving obstetricians, midwives, anesthetists, and blood bank personnel to manage PPH effectively. Each case may vary, so management should be tailored to the individual patient's needs and available resources. Thank you for watching NextMeds. Please like and subscribe for daily videos about health, nutrition, and diseases.